In this video, we'll be talking about administration of inhaled medication. What about it? This station is still going to be handled as so as you are administering medication. Of course, inhaled medication, it is still medication. Yeah, it is just because the route differs, okay? In your implementation, for the purpose of OSCE, it's strictly per hora. Yeah, you're not going to administer through other routes for in implementation. But this station is inhaled medication. All right. I want you to watch the video to the end because towards the end, I'm going to be sharing some top tips regarding this station. So without further ado, let's dive into that. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm, I rub palm to palm, right palm over left bosom, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I allow it to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? The reason why I'm here is doctor has ordered your inhaled medication be administered in order to facilitate proper breathing for you. Is it a convenient time to do that, please? All right, thank you very much. Before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, so I have here Janet James. Janet James. Your date of birth is 0101-1992, 0101-1992. Your hospital number is 1234567, 1234567. Fantastic. Assessor, I can confirm I am with the right patient. Do you have any allergies at all? Okay, bless you. There is no allergy, or it is properly documented in my notes that you have no known allergy, and that is why you are not on red wristband. Okay, how may I address you, please? All right, Janet is fine. Okay, before I step aside to prepare the medication, can I take you through your medication, your home chart, if that is okay by you? All right, thank you very much. So I have the aim chart for Janet James. The address is 27 Dalton Grove. The date of birth 0101-1992. Your hospital number is 1234567. Okay, and you have no known allergy. The prescriber is Dr. Tolu. The medication is salbutamol. The dose is 100 microgram equals 1 puff. The weight is 1.5 meter. The height is 72 kilogram. The signature of the doctor is there and is properly documented. It is a valid and legible prescription. All right, Janet, salbutamol, what it does is facilitates proper breathing for you, to make you to breathe at ease, because the way you are breathing now is not okay with us. All right, so we want you to be much more comfortable. Some of the side effects you may or may likely not to manifest include, and not limited to, lightheadedness, headache, or dry mouth. Are you still happy for me to continue, please? All right, thank you very much, Janet. So I'm going to be stepping aside now to prepare the medications. Is that okay? All right, thank you. Leaving my patient bedside, I'm going to perform my hand hygiene following the 7 steps of WHO standard. All right, assessor, could you please confirm my tray is clean and is ready for use? All right, thank you very much. I have on my hand salbutamol. It is not expired. The expiration date is February 2026. SA in date. I'll go ahead and compare that with my chart to be sure it is a correct prescription. I have on my charts the same salbutamol, 100 microgram equals to 1 puff. It correlates, so I am happy to administer to my patients. Prior to every drug administration, the 6 rights of medication needs to be ensured. The right patients, the right medications, the right dose, the right route, the right time and date, the validity and correctness of the prescription, then the proper documentation, which I'll be doing after the administration of the medication. I have the cyst right, correct? And I'm happy to proceed. All right. So I'm happy to proceed this with this. Also, I have spacer device. It is clean and intact. Assessor, could you please confirm the spacer device is still in date? All right, thank you very much. I am happy to use. All right, so I'd already worn my apron here. So I'm going to pick a pair of gloves now and keep it in my tray. Okay, then I'll perform my hand hygiene following the 7 step of WHO standard as I go back to my patients. All right, Janet, I'm back. Are you still happy for us to continue, please? All right, before we continue, could you please confirm your full name and date of birth while I double check with my paperwork, please? Okay, so I still have here Janet James. All right, your date of birth is 01/01/1992, and your first line of address is 27 Dalton Grove. Then your hospital number is 1234567. It's properly documented here. So, assessor, I am still with the right patient. All right, Janet, is it okay to assist you to sit up in an upright position, please? All right, thank you very much. Okay, can I confirm if you can hold your breath for 10 seconds and more? Oh, fantastic. Okay, I'm going to be putting this spacer into your mouth. Okay, I want you to form a tight seal around it. Okay, so I'll go ahead and shake my salbutamol 2 to 5 seconds. All right, I will attach that to the end of the spacer device. Okay, I'll be tilting your head slightly backward now. I want you to inhale slowly and deeply. All right, then here you go. I want you to form a tight seal with your lip and teeth round the mouth of the spacer device. I'll be depressing the canister now. I want you to inhale for 2 to 3 seconds. Hold your breath for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. As I remove the spacer from your mouth, could you please exhale through a pursed lip? Correct. How do you feel? Are you comfortable? All right. So I'm going to be stepping aside now to document what I've given you, and I'll be back to attend to you shortly. But before I go, it's worth mentioning that the device, you can wash this spacer as well as the canister that houses your inhaled medication. You wash it in a soapy water and run it through a tap to rinse it. And you make sure it is completely air dry and before you pack it for the next use. This is how to care for the spacer device as well as the canister. Is that okay? So I'm going to be stepping aside now to quickly document what I've done, and I'll be back shortly. Is that okay? All right, I'm back. Are you still comfortable? All right. Thank you so much for your time, and I will see you some other time. Thank you. So I'll go ahead now and clean my equipment, prepare it for the next use, and perform my final hand hygiene according to the 7 step of WHO standard. So that is that about this station. It's as simple as that. The key point here is the sitting up position for this patient. Ask if they can hold their breath for 10 seconds or more. And if not, if they can hold their breath for 10 minutes and more, meaning you're going to be using single breath technique. And if not, if they cannot hold their breath up to 5 seconds, meaning you're going to use multiple breath technique. And that is all. In your exam, it could be 100 microgram equals to 2 puff. However the case may be, you treat it accordingly. But in this scenario I've just demonstrated, it was 100 microgram equals to 1 puff. It could be 200 microgram equals to 2 puff. You follow suit according to what the prescription states to you. So I hope you've learned in this video. I would want you to drop the next video you would want me to make for you, and I will try my best to bring it to our table. Yeah, please, it is a new channel. Do subscribe. Subscription is free. Do subscribe to see more videos like this. Like and drop lovely comments. Until I come your way in my subsequent videos, keep practicing OSCE.